Hi everyone, Nigel here from Phoenix Rehab. I'm a hand therapist in Phoenix. And today I'd like to share with you quickly on mummy's thumb. Medically, is known as the Quervain tenosynovitis up here, right? So this is actually a very common condition that we treat in our clinic. Basically, what happens is that if you see image A over there, there's swelling of the tendon and the tendon sheath at the wrist below the thumb. What causes this is basically a lot of use of the wrist and the thumb in this kind of motion. This kind of motion, right? What happens that with overuse or even like a direct fall damage to it where you kink the joint terribly, right? That did cause a lot of injury and inflammation. Inflammation leads to pain and swelling. And if it's left untreated, it can get more painful. Most of the patients, even 95% of the time, they don't need surgery. Hand therapy is enough. Only a small number of patients, it becomes just too sharp the pain. They just need injection or surgery. So there are risk factors to developing decrevance. Being a lady is one of them. Being 40 and above, there's more wear and tear when you're older. If your work or hobby or sports has a lot of wrist motion, for example, you are a caregiver, you take care of patients, or you are a teacher, you have to leave kids, you have to change them. If you are a chef, a cook, where you do a lot of cutting and do a lot of this motion or gripping, anything that uses a lot of wrist, or if you're sports, like you like golf, you like tennis, you like anything that uses a lot of your wrist, you do with the racket games or a lot of throwing games, that puts you more at risk of developing decrevance. And of course, the traditional one is that where if you have your own kids, right, caring for one or more kids will definitely put you at high risk of developing mummy's thumb. Simply because taking care of a kid involves a lot of lifting, a lot of wiping, feeding, changing, washing, and that's why the original term earlier in last time is called mummy's thumb. Right now, even a lot of dads get it. I got it myself. As the more hands-on you are with your kids, you just get it, right? So the common symptoms are sharp pain over the area, like in A, sharp pain there when overuse or with use, especially. And sometimes some patients will complain of weakness. It's called pain-induced weakness, where your body actually decreases your use of the injured part because there's an injury there. And that's quite common. So don't worry, all this kind of weakness, this pain is temporary. Okay, so let's talk about diagnosis. So the test that we use to check for decrevance is called Fingerstein. If you see B over here, Fingerstein test. So Fingerstein test is a very simple test. So what you do is that you put your palm this way, your thumb out, you slide your thumb over your palm, right? And then you close your fingers over. And then you move your thumb away from you this way, right? I'll show it to you one more time, this way. So for most people, they feel like a bit of a pain, a bit of aching pain over here, a pulling pain, and it's fine. But for people with really severe, moderate to severe decrevance of mummy's thumb, right, they'll feel a sharp pain on a scale of 0 to 10. 10 is massively painful. 0 is no pain at all. For patients who are experiencing above 5 over 10, right, they should immediately seek help already. So they can see a hand therapist, they can come see us, they can see their doctors, whoever, right? And that confirms decrevance most of the time. And of course, the area will be tender and painful with touch and pressure. If you want to be more extra accurate, you can actually double confirm it with ultrasound imaging or MRI as well. At this point, when you confirm you have the decrevance, you have two options. Either you go down the invasive, which is surgery injection way, or you can go down the conservative, which is non-invasive, which is hand therapy. So what I tell patients that if they have severe pain, sharp pain, like 8, 9 over 10, 10 over 10, sharp pain, whenever they use their injured hand, which means that they can't zip their pants, they can't wear the bra, they can't brush their teeth, they can't comb their hair, they can't do anything with their injured hand without sharp pain, right? They should see a doctor, get the injection or do a surgery. You can just do the injection first, and injection works, then you can just leave it be. If the injection doesn't work, then you can grade up to a surgery. But for anybody who has decrevance, but it's not so bad, we were talking about 7 over 10 or 8 over 10 in terms of pain and severity. What we do is that I recommend hand therapy. It's non-invasive. There's no injections. There's no medicine. What we do is a very conservative way of management, which is a combination of, you see below here, yeah, here, right? Most of the time, we will give you a immobilization splint. We customize a splint to protect and immobilize your wrist, your hand, wrist, and thumb to prevent the tendon shift from being aggravated again for a period of about 3-6 weeks. And then when you're ready, we stage your activities and exercises, a combination of tendon gliding, hot and cold therapy. When you're ready, when your wrist is ready, we do gradual strengthening. We don't just push out the strengthening so fast. We just do in stages. And of course, you definitely will need a course of ultrasound therapy. This will accelerate soft tissue healing. And this is what Mummy's Thumb and the Quervain's all about. So this is how we manage it. So if you have any questions for me, write down in the comments below. Let me know, and I do my best to serve you. Take care. Bye.